Hello and welcome to episode 7 of the On Air Advocate podcast, where we look to provide education, support, and empowerment for all of those with different abilities, mental and medical illnesses, and their caregivers. My name is Tammy Flynn, and I am your host as well as producer of the On Air Advocate, and I am absolutely so thankful and grateful that you've taken out the time out of your day or evening to hop on over and check out episode 7. Super excited today that we have an amazing support service within our community. I have Ronnie Frederick here from Con-I Therapeutic Massage Therapy. Now, I met Ronnie back about 2 years ago when my son had his full spinal fusion. She offered us so much information and knowledge, and here we are 2 years later, and she is sitting in front of me in my studio. And so knowing what an amazing resource that she has been to myself and family, I wanted her to come in today and really just kind of talk about how she got involved in medical massage therapy, pediatrics, as well as specializing in oncology. So without further ado, Ronnie, I'm going to have you come on in and let us know, how did you get started in the massage world? I mean, I've known you for 2 years, but I've always known you in the realm of the hospital world, of the medical behind it. But how did you start your business, get into the massage, field? And then when did that turning point come for you that you said, I want to take this therapy service to a whole different level and really start to aid the individuals that are sick and in need?
In 2009, I had a life-changing event which led me to massage therapy. It was either massage therapy or nursing school, and massage therapy was sooner, quicker, and it's something that I had always wanted to do as a child. So after massage therapy school, I started working in just a simple spa-related
the normal massage and spa world. And for a little note, for some that don't know, I also own a salon and spa as well. So that is a whole different realm, though. People do come for the relaxation. They do come for the smelly aromatherapy moments, but definitely completely different than where your career kind of turned.
Therapeutic in itself, but a completely different approach. And I knew that I wanted to be very therapeutic in my approach. So as I was doing that, I started building my business and working primarily with adults. Given that I was coming into my 40s, I knew that I couldn't sustain that type of work for the duration of my now new career, because I'm not going back.
Right.
So I felt that oncology massage was going to be a nice transition because it wouldn't be so physically demanding on myself. And to take that farther, now I was thinking pediatric massage and was presented with a wonderful opportunity to work with children locally in a local hospital to offer just that. With that opportunity, I went and sought training through a very well-known organization called Little Kids Foundation and took training through them, certified pediatric massage therapy. That same weekend, I continued on with an advanced therapeutic pediatric massage class, which was trauma related. So dealing with hospitalized kids who have had or experienced physical trauma, emotional trauma.
Okay, and then I know that when we met each other, I was in a very traumatic situation myself, my son undergoing that full, spinal fusion, and he was in such pain. And so when I met you, it was kind of that parent desperation at that time inside the hospital, like, how do I get some of this pain relieved? And so I know that in the past we have discussed there is a lot of different components to it, from the relaxation, end of it, to calming for the kids. But there's also that treatment for when you have, a whole back full of titanium. And this is hilarious. I'm just going to note this. It is like hailing outside in the middle of winter in Wisconsin. And so I'm very sorry if you're hearing any kind of crackling in the background. That is it hitting the building. And so I just want to make note of that. That is not us, but how crazy is it, like 55 in Wisconsin
right.
in
and
January?
Foggy.
And foggy. Yes, definitely global warming. Something's changing. So when you're making those, the plans and the different kids that you are seeing for the different traumatic situations that they're in, how do you approach that when it's more of like a surgical, procedure where now they have, like I said, a whole back full of titanium?
So with a treatment plan philosophy, if you will, you have to identify where is the child. Are they in the acute phase or are they subacute? And so based on that, you then develop your treatment programming or your treatment plans. In the subacute area, we are more flexible on what we can do with manipulating tissue. We can be a little more aggressive to get range of motion, to address any scar tissue before it really starts to get crazy and locked down, which could, eventually cause pain. We can deal with non-pharmacological pain management through relaxation.
Now, what do you mean by that? Because now if someone's listening, they may not know your terminology, because sometimes I don't know it as well.
Yes. So in your son's case, there was a lot of medication to help manage pain, to help relax muscles, to help with all these other symptoms that he was dealing with post-surgery. So in that case, non-pharmacological approach is non-medicine related therapies, if you will. So in this case, massage therapy, touch therapy. It's a non-pharmacological way to help manage pain, to maintain quality of life.
Okay, and when you're in that beginning stage right after a surgical procedure that happens, that is when the steps are very, very slow. And I know we were discussing you don't really get into the deeper manipulation till you are further out from the surgical procedure. What is usually the protocol on that?
Correct. So in that instance or in that situation, it would be more comfort, relaxing touch for the patient, for the child. This is going to be more hand placement, very intentional holding, touching, not just feathery touch, but just very intentional, loving, therapeutic touch. And that's going to be mostly palms based on the size of the child. If this is an infant we're talking about, or even a premature child or infant, we would then be using fingertip touch.
Okay, so that's in the very beginning, because I was going to ask you about that. Me and you have discussed a lot about oncology, adults, and patients that way, and then also youth, children. But for the infants, is that always more of that touch? I mean, there's specific for the infant massage in pediatrics. Is that always just touch, really no types of deep manipulation? Is there any times that does come into play?
Correct. So for an infant, it's always going to be gentler. More than we know, our babies who are well, healthy babies, can take some nice, firm compression to their extremities, their feet, their palms. We're never going to be too deep, to be too aggressive. And that almost is a do no harm approach. And this is through therapists and families themselves. I don't imagine any parent would go in and squeeze their baby, so tightly that it would be unreasonable. But it could be just a lotioning type approach and introducing your child to that type of technique and that type of touch and making it part of everyday life.
Okay. So the infants we've kind of covered, then we have our regular pediatrics. Now, what about whether it be children or adults that are in more of that oncology area? What is the specialty? What have you learned, so much? Because I know you've done a lot of classes and you have a lot of awareness and knowledge around that.
So one thing to start from is if you're talking about a healthy, well child, at the age of 11, 12, depending on where we are, this society, we see our children more developed at certain ages. So you have to make the best judgment on, is that body a close to adult body as far as size? And then from there, you now need to assess intellectual or cognitive development or level, if you will. I'm at a lack of terms. So if you have a adult body, 17-year-old, but is an adult body, now you look to how does this child think and talk and react or learn. If that child is on the adult side, then you can treat closer to that. You can use those types of therapies. If this child or teenager is acting more below that 17-year-old
their developmental ability,
yes, then we're going to treat to the cognitive level.
Okay.
So talking in terms that are understandable to the person and treating appropriately that way. So adjusting techniques. Okay.
So when they're going through treatment and whatnot, for adults or for kids, that are either, going through cancer treatments at the time or survivors, afterwards, is the purpose of it more for the touch, relaxation purpose, anti-anxiety, or is there other types of pain, that comes along with that, that you were trained, that you were trained on the classes? What are some of the things that people experience that are going through that, their body, aching bones, muscles? I'm not, that's not my scope as much, though I have some amazing moms and kids and families around me that their children have went through this. But in this aspect, we haven't talked a lot about that. So muscular-wise, bone-wise, what's happening and how can what you provide help?
So there's all of that. In the hospital setting, lives are disrupted. Children who are normally with their friends at school are now withdrawn from that socialization, from the play. In that setting, in the hospital setting, there's going to be depression. There's going to be anxiety from hospitalization. There's going to be the frustrations and just changes in mood, perhaps even behavior and activity. So we address those symptoms, if you will, through therapeutic touch. Massage is an evidence-based practice. There are so many different studies out there that address how massage has positively affected depression, stress, mood anxiety. So we have used many, many techniques on the relaxation side to help with that. That can be simple compressions to the feet, rotation of the ankles, palms, massaging hands, and gentle massages to the neck and shoulders. All of this can help with bringing down those cortisol levels, those stress levels, lowering blood pressure without being too aggressive. So on the oncology side, we don't want to ever be too aggressive coming into that soft tissue, if you will, because the body's already fighting with the chemo treatments and all of those medicines that they're receiving based on their protocol.
Okay. It is just, it's amazing work that you do. And, something that I find so comforting is when we met at the hospital, I was like, oh my gosh, you're another level of relief. Because if anyone has ever undergone a surgical procedure themselves or been in that area of watching their child go through excruciating pain and not being able to help them, you will do anything. I would have moved a mountain to relieve some of that pain. And so when I met you at the hospital and we were able to kind of strategize a little bit and coming over in that whole process of relief, I found it one of the most effective and helpful supports that I could have ever had, because not only did you bring, even if it was only for a little bit of duration of the day, the pain relief, to my son, you also were able to come to my home and, provide that, because, obviously we couldn't leave and we were homebound. And I know that there has to be many other parents that are in that situation. You're discharged from the hospital and even getting to your therapies, it is like an ordeal to get to PT and OT and, for all of those other things to recover from. And you really need them in home. And so when did you decide to kind of, I don't want to say take your show on the road, but when did you decide that, from working inside the hospital, being in the pediatrics realm and in the medical realm, when did you decide, hey, it's time that I really need to be accessible to these families because I may, meet them, see them, whether it be at the hospital or in other in other settings, that I need to be able to provide to them that way?
So it started well before any of my pediatric when I went down that path.
Okay.
My business was a mobile business. It was a serve you where you are, help you where you are, if it be in your office space, in your home, in some organized studio or massage facility. I had always wanted to be a mobile service, if you will. So it's from the beginning. It's been from the beginning.
Okay. Mm-hmm. Now, isn't this funny? I've known you for 2 years and I didn't know any of that.
Yes.
Clearly, we have a lot of other things we talk about. But, I think aside from the pain relief that you can offer, the calming, anti-anxiety, helping families through that time, or even adult patients through that time, you are also one of those people that is just so incredibly comforting to be around. And so... Oh my gosh, I'm going to cry.
No.
Don't cry. Sometimes I get like that. But coming into my home, and especially when you have a child that has different abilities and you have gone the road of seeing millions of doctors and therapists and whatnot, and your friends really become your therapists, I have found that you coming here, especially during that time, for the first time in our lives, we really couldn't leave. We were very, very, very completely homebound. Yeah. To have another fresh face and set of eyes and your positivity was absolutely amazing. So I just can't say enough about that. What I did want to also touch on is, we talked about that we never want to put families in the position when you're looking for support that's going to put them in a hardship. Because of it. And that is definitely not your mission, within any of this. And so through some different insurance plans and whatnot, I know that some through employers and whatnot, as our ever-changing healthcare system does.
Yes.
It will offer some type of a relief for that. And with exploring further through this adventure of insurance and payments and whatnot, my adult son, who is disabled through the state of Wisconsin, he does and is eligible for a service called IRIS. And so that is for only over the age of 18, so not under, but they were able, with the funding sources that we got from them, to be able to have you coming out for those days of the week and continuing that service now for the last 2 years. So I just want to let parents know that when you look at medical massage and you look at it as a necessity for pain management, you really do have sources out there that may be able to cover it. Sometimes I've heard from parents, they're like, well, that would be, they think of it like massage, just relaxation. And so what you have to look at it as that it is, aside from being therapeutic, it is medically necessary. And so myself looking at pain management for my son, as well as getting back on his feet and growth for all of that, it has become a medical necessity for us. And so something that's awesome is through this process and exploring, we were able to get Iris involved. And now, Ronnie, you are an Iris
approved provider.
Yes. Approved provider. Mm-hmm. So that is something that others, and in the state of Wisconsin, we are very, very, very fortunate to have the program Iris. We really are for our adults with disabilities. And so I just think that that's wonderful for people to explore. So if they do have questions, I definitely would take that to the Iris providers. And, the Iris gets provided through the ADRC, which in further podcasts, we will have some of the other supports in our community on to explain that a little bit further. But just so you all know, listening, that is covered under our Iris program here in the state of Wisconsin. Not sure for other states, though, but I know here it is. Now, you were referencing before when we were just chatting before the podcast about some other kind of avenues, too.
Yeah, so some insurances can or do accept massage therapy. So you would certainly have to look back at what your provider, your healthcare insurance company offers. In some instances, some clients can use their health savings accounts to seek reimbursement for therapeutic massage services.
Okay, so that's more of like a tax deduction. Is it like tax, like not taxed money, or
correct?
That goes into there.
Correct. It's money that goes from your paycheck directly from your company into this health savings account. I can't speak much beyond that. I don't have enough knowledge about the technical ways that is handled.
All right.
But I do know that I do have clients who use their receipts from massage therapy and will submit it to their insurance company for it to deduct from the HSA.
Okay. So what I would just say is I definitely would tell you to investigate. If you're in doubt, if you're not sure, I would investigate whatever community services supports that you have and see if they would support that. If not, checking through an employer to see if they may be able to help, because sometimes when things are in more of a traumatic, life-altering, short situation, a little bit different than when it's a lifelong condition or disability. I know that, there's different coverage levels and everything at that point where, sometimes you can get care for such a period of time, but then it ends, at some point. I also wanted to kind of go back to just chatting about when you're coming into the home, I feel like I have really gathered much more than, which was a lot, but the relief of pain for my son, as well as the companionship and comfort that I've received from you as well. But then to top that off, you are so educationally based in all of the things that you do and always exploring. And if you don't know the answer, you will find the answer medically.
It's important.
Yes. And it's not just like, it's this area or whatever. It is pictures and diagrams and whatnot. Can you speak to that a little bit about when you're working with families and individuals, adult patients, what is your level of commitment there in finding out that information, for them and how you articulate that to them?
So just as on a continuum, if you will, from your hospital experience, you have people who come in to explain exactly what's going on with respect to medications, dosaging, treatment plans, this type of thing. And they make sure that you understand all of this and they give you opportunity to ask questions. For my practice, same thing. I want to educate parents on what's going on given the situation. So let's say with Marcus, he has the long incision from cervical region down through his lumbar spine. We know that we had to avoid that surgical site for many, many weeks. I mean, even past the education of massage therapy past that 6-week mark of not touching, surgery sites. We had to avoid that because there was so much deep healing that still needed to be had. So we educate ourselves. I educate you as to, well, at some point, even though the doctors are saying one thing, massage at certain subacute stages can be very beneficial for trying to break down that scar tissue that's already starting to set in, rather than waiting for everything to be 100% healed. So there's that aspect.
Okay. Yeah, and that, I think, is another just a huge benefit because knowledge is power, and understanding what is going on with your loved one, whether that be your child or an adult, is such a need and such a benefit because that can help you also advocate for them in a much better format. Absolutely. When I talk about, advocating that way, when you have more eyes on your loved one, the better, because you're seeing it through different perspectives. And so even with you coming in, you definitely brought up some different questions to me from time to time, which then I took to my surgeons, I took to our team and kind of bounced that off of them to make sure there wasn't any other things going on. So I think that is absolutely phenomenal that you give the knowledge, which gives the parents and the individuals the power. But where can someone find you? Do you have a website, a Facebook page, a location? Obviously, when we're talking about this as patient care, services, most of those would be in-home if they're not seeing you at the hospital. Yeah. Where would they get a hold of you at?
Yes. So I do have a Facebook page, and that is Kannai, Kannai Therapeutic Massage, LLC. You can find me there. If you did a general Google search for me, my business will come up with a contact phone number of 414-324-6258. And if email is a preferred mode of communication, you can email kannai.massage@gmail.com.
Wonderful. Well, I cannot thank you enough for taking the time out today to sit down and to share this amazing support with our community. I think that, like we were talking about, knowledge is power, talking about things, having conversations, getting out there, making sure we know the supports that are available and we know what can benefit our loved ones. So with that being said, I thank you all for listening to episode 7 of the On Air Advocate. And I can't wait for you guys to check us out on our website at www.onairadvocate.com. You can find all of our social media links there, from Twitter to Instagram to YouTube, our podcast, everything. So until next time, God bless. Thank you so much, Ronnie, for being here.
Thank you.
Bye-bye.